Hello everyone, I am Dr. Sunil Kar, Director of 3S Dental Care, and today I am going to discuss a very important topic for everyone, that is crown and bridge, that means artificial tooth. And nowadays it is very common for everyone to replace artificial teeth. So for example, somebody, if he doesn't have tooth or teeth, so they want to replace it with artificial teeth with crown and bridge. Now how they will decide which material to select, and how they will decide whether the crown is successful or the crown is going to work out or not. For example, suppose a person is coming to us with a missing teeth. We are giving him options for implants and bridging, or suppose a person has gone for root canal treatment and we have given him option for a single crown after root canal treatment. So how they will decide that which material to choose, and how they will decide that their crown which has been fixed is working out properly or not. The first criteria is selection of the material. Selection of the material means which crown we are selecting. Suppose this is root canal treated teeth and we are fixing a crown over here. So which material to select? For example, there is a lot of materials like stainless steel, cobalt chromium alloys, titanium, zirconia, all ceramic crowns and gold crowns also. So patient cannot tell that he wants this crown or that crown. We have to tell the patient that these are the options. For example, gold crown is the option, titanium crown is the option, metal ceramic crown is the option, and porcelain fused to zirconia is the option, PFM crowns. So depending upon the bite of the patient, we have to select the material. Nowadays the very commonly used material is zirconia, titanium, because they are very biocompatible and the marginal deposit around the crowns is very less, and the chances of bacterial infection is also very less, and aesthetically, that is, zirconia crowns are much better than any other crowns. And after that, once the crown is fixed, then the patient has to maintain it properly, and the patient can feel the marginal integrity, and we can confirm the patient, and we can give a guarantee to the patient if we are selecting a proper material that the marginal fit around the crown is perfect. If we are selecting a titanium crown, zirconia crown or gold crown, the marginal fit, if you compare it with metallic crowns or stainless steel crowns, is very less when we compare it with zirconia, titanium or gold crowns. And second is occlusion or bite. Suppose we have given a good marginal fit, we have given a very good material, but the bite or occlusion is not perfect. That means when the patient is biting, the balance is not proper. Suppose the patient is having that ऊंचा लग रहा है or height feel हो रहा है, that means the bite is not proper. So in that case also, whatever perfect work we do, if the bite is not perfect, the patient's crown is not going to work out. So we have to correct the occlusion. Occlusion means bite. It is a very common term right now. Occlusion is a medical terminology used, and bite is the layman terminology used for occlusion. So bite has to be perfect. ऊंचा नहीं लगना चाहिए, या फिर it has to be perfect both the sides, balanced both the sides, then only it has to be guaranteed that the crown or bridge which we are giving to the patient will be working out in a longer run. And which occlusion to be given, that is also decided by the clinician, not by the patient. What type of occlusion is given to the patient is also decided perfectly according to the material used and according to the previous dentition present with the patient. Then the very important thing is adjacent teeth. Suppose we are giving a crown or a bridge and we have given everything best. We have given the best material, we have given the best occlusion, we have given everything perfect, but the adjacent teeth are not perfect. That means the infection will spread from the adjacent teeth to the crown and bridge abutment teeth, and again the problem will start. So again the third thing is the adjacent teeth. The first thing is material selection of the material, second thing is occlusion or bite, third thing is adjacent teeth. So whenever we start a treatment, we always start with repairing the small intricacies, that means small caries which is present or small deposits which are present around the teeth. We have to clean it first, we have to make the surrounding area neat and clean, and we have to make the oral hygiene perfect, and we have to give instructions of oral hygiene to the patient so that the patient can maintain it properly. So after fixing a crown and bridge, or before fixing it, we have to give proper oral hygiene instructions to the patient, so that after also fixing the crown and bridge also, the patient can brush properly after giving him the proper, or him or her the proper brushing instruction, how to maintain the teeth with proper mouthwash, which toothpaste to use, which mouthwash to use, whether gum problem is there with the patient or not, whether the patient is diabetic or not. If the patient is diabetic, what extra care he has to take, that is a different separate topic again. Diabetic patient's oral care, that is a separate topic. If the patient is having some osteoporosis kind of thing or bone problem, then what precautions he has to take, what medications they have to take. If the patient is already under medication for some cardiac disease or some other kidney disorder or nephrotic disorder or some antipsychotic drugs, then what are the precautions that the patient has to take? Or the patient is always traveling, then what are the precautions or what are the care that the patient has to take? So these are all the things which we have to explain to the patient prior. And diagnosis is very important before giving any crown and bridge or any implant to the patient. Diagnosis is very important. We have to take proper medical history of the patient. We have to ask the patient whether he is or she is having any kind of disease or he or she is having any medications or not.